Thank you, John. Can you hear me back there? Excellent. Buenos dias. Good morning. It's truly a pleasure being here, and I want to thank the Planning Committee, each one of you, for really giving us a really great conference. I see that the fire alarm that we had last night was a good sign that St. Louis is here, gave us a good scare, but really has welcomed each one of us here, and I appreciate that. Today, I have the distinct honor of sharing with you information about a project, R24. I'm not the principal investigator. We have three, Elena Portocolon, Adriana Perez, and Carl Hill. They send their hellos, their good mornings, but you're going to get me today in terms of presenting information on leveraging national infrastructures that are co-led by Latino partners to increase Latino representation in clinical trials on dementia. But I do want to say we also have another co-speaker today, Scarlet Mendez, who's here in the audience, and she will come up in a bit to give us more details regarding the intervention itself. I will, let's see, which one is it? This green button?
The big green one.
The big green one, okay, not the bottom one. All right. So what I'll do is I'll set the stage, give information regarding the project itself, but then Scarlett, like I said, will come up right after me and provide information or details regarding the different activities that were actually implemented on the ground. And then I will again take the stage and talk a little bit about the lessons learned. So we'll have that loop here. I'd like to introduce the scientific team, our co-principal investigators, the co-investigators, and like we've always used the remark that it takes a village, this indeed has been a project that takes a village to implement. And this was also a project that was responsive to the program announcement examining diversity, recruitment, and retention in aging research. So what do we know about Latinos, Latinas, Latinx, Latina, Hispanics? And as you know, what you call yourself and the words and terms that you use, that was discussed yesterday, and I do want to affirm that. It's very important for us to understand the subpopulations that we're working with, the labels, the identities, the historical backgrounds that they identify with. Today, I'll use the word Latinos. So we do know that Latinos have higher dementia risk, yet are underrepresented in ADRD research, including clinical trials. And I asked you, ¿y qué?, which in Spanish means, what's the so what about that? Well, we know that low representation leads to high need, missed scientific and care opportunities, but it also means delayed diagnosis or misdiagnosis. And that could lead to low quality diagnostic treatment, care, and support services. And this has implications for ascertaining precision treatments, acceptability, adverse events, etc. So the status quo continues. There's low knowledge, low trust, low numbers, and what we also talked about yesterday, the issue of poor science. So our goal in this particular project was to increase the number of Latinos that were informed and engaged in Alzheimer's disease clinical trials from a position of knowledge and agency decision-making. So we worked on the ground with local agencies, but one of the landmark, or I said indicators of this particular intervention was the fact that we also worked with trusted national organizations. So we had aligned our participant referrals with an ongoing clinical trial, and I'll talk about which trial was that in just a bit. We focus on simultaneously addressing meso and micro level intervention components with 2 national and local organizations. Then we identified which interventions were replicable and also sustainable over time and scalable. and we co-designed our local outreach and engagement strategies, which Scarlett will talk about in just a few minutes, on behalf of Latinos across the U.S. And we documented these processes, outcomes, and lessons learned. So we worked with the AHEAD, and many of you already know what the AHEAD clinical trial is. We directly aligned our patient referrals. So we worked on the ground, we developed strategies with our local partners and also with our 2 national partners, and we actually referred our participants, our Latino participants that we worked with across 4 sites in the U.S., and we worked with, by developing referrals to the AHEAD sites in these 4 cities. As you know, the AHEAD study is a prevention trial to address potential memory loss in Alzheimer's disease. And we also attempted to increase Hispanic or Latino representation by doing this. So what did we do? We developed an MOU with 2 national organizations, the National Association of Hispanic Nurses and also Alzheimer's Association. And in these MOUs, we identified what the agency or organizations would be doing at a local level. And we also saw that they had similar and complementary goals in terms of their mission, looking at healthcare, developing culturally sensitive intervention models, developing research to increase awareness of healthcare needs, engaging in advocacy research, and also holding dear the importance of accessibility, diversity, equity, and inclusion, etc. So our project was called El Consorcio, which means the consortium, and this consortium highlighted very prominently the collaboration and the partnership with the 2 national organizations, a National Association of Hispanic Nurses and the Alzheimer's Association. And as you can see from this slide, we worked in tandem with local organizations, and we developed almost like a trifecta. The national organizations on one side of the triangle, on the other side, the local partnership organizations and groups that we partnered with, but also the outreach specialists and the work that they did on the ground. So El Consorcio was established with these trusted local and national organizations that had a national reach and an infrastructure to rapidly implement scalable recruitment strategies nationwide. And these strategies encompass such things as community events, activities, tabling, many different types of events that were very much either common across the 4 sites or unique to the specific sites. And those sites were in the cities of San Francisco, San Antonio, Miami, and Boston. And you can see there the different organizations that were presented in our efforts. So what were some of the things that we engaged with and we partnered and developed at the local level? Well, we developed novel community-based outreach and engagement strategies. Again, Scarlett will give more details about that. We also developed linguistically and culturally tailored activities that were geared towards the general public, but also to the agency or local organizations, consumers, or clients. We planned and delivered activities that involved a bilingual and bicultural workforce, and many of us on the advisory and scientific teams also have had decades of experience in this area, and we shared our lessons learned with the people on the ground. We also drew from outreach, recruitment, engagement expertise of the scientific team and advisory groups. We have 4 outreach specialists. Scarlett is one of them, Yanexi Rivera is the other one, and Brianna Colado and Josue Velasquez. And they had very important and key roles in our intervention. One is they handled all the on-the-ground logistics and planning. They also were involved in developing culturally tailored strategies, some that we'll talk about today, and also making sure that referrals were provided to the AHEAD site team. They also were involved in giving us ongoing, timely feedback regarding the events, the activities, and the process of the referrals. We also developed not only the main El Consorcio website, but we also developed websites that were pertinent to each one of the 4 national sites. Similar to a presentation that was given yesterday, we contracted a Latina brand strategist and graphic designer. She led 2 what we call discovery workshops with all of our collaborators to identify, the different names that we use, the different phrases, the materials, the website development, etc. And she integrated feedback from the outreach specialists in the research team to, again, design the recruitment flyers. All the PowerPoint slides were branded, etc., etc. With that, I'm going to turn it over to Scarlett, and then I will return to give a summary.
Good morning, everyone. My name is Scarlet Mendez, as Maria mentioned, and I will be talking about El Consorcio intervention. So the intervention design. So this included 1 presentation, 2 tabling events, and 20 venues where we left our recruitment flyers. So we had a member from the Alzheimer's Association, the National Association of Hispanic Nurses, and the AHEAD study attend each of these monthly presentations. And other components I will be talking about include special events and celebrations, our web pages, blood pressure checks, and interagency collaborations. So to start off, at our monthly presentations, our attendees played Loteria, a game that is similar to bingo. And so my colleagues and I ultimately designed this Loteria that was relevant to our intervention, but also to Latino Hispanic culture. So we were able to utilize this game as a way to reinforce different topics such as inclusion criteria. So for example, when drawing the 55 years old card, we would state that this was the minimum qualifying age for the AHEAD study. We also got feedback from audience members expressing their excitement when they saw iconic Latin images like Cesar Chavez. And these are some images from our community presentations at the 4 different sites. So for our recruitment flyers, as mentioned, we did 20 venues per month. And the flyers, just as everything else in our intervention, was available in English and in Spanish. So my colleagues and I aimed to leave the flyers in zip codes that were predominantly had a higher Latino Hispanic presence. And we also left the flyers at venues that were Latino Hispanic owned businesses. Our flyers were pretty standard and consistent across all sites with minor tweaks to accommodate. So for example, our community-based organizations informed us that having paletas alongside Loteria was something that the community would enjoy. So throughout the intervention, we continued being intentional with details that would assist us in connecting with our audience. So special events, El Día de los Muertos or Day of the Dead. El Día de los Muertos is a way that many Hispanic Latinos honor family members who have passed away. And so my colleague Josue created an electronic altar where any team member from the Consorcio intervention could honor a loved one via Facebook. So this particular altar on the left happens to be of my grandfather. And on the right, my colleague Brianna went to a tabling event where this was definitely a conversation starter. And so once again, this gave us the opportunity to share something personal about ourselves with the community that we were each in. In addition to each website that Maria mentioned, we also had our Facebook pages where we had posts about local events as well as facts relating to Alzheimer's disease. And so a selection of posts were paid to boost their advertisement to increase reach and participation of Latino Hispanics in the local area. And these are just some images of Facebook bios of each of the outreach specialists pinned to our Facebook page. So blood pressure checks. So in the United States, as many of us know, heart disease is one of the leading causes of death. And so my colleagues and I continue to look for strategies that we could utilize, and we ultimately decided to use the relationship between heart and brain health. And so we created a pamphlet that was given to community members where the nurses on our teams would log the blood pressure readings and provide teaching and recommendations. And so again, another conversation starter that led to providing the community with information on Alzheimer's disease and the AHEAD study. And these are some images of our team at tabling events that were hosted by different agencies. And our intervention truly was not possible without these collaborations. Although my colleagues and I were familiar with the Latino Hispanic communities at each of our given sites, the true experts were those that opened their doors to us and gave us the opportunity to integrate ourselves in the communities. And so our Monday reflection meetings. So I feel that the first bullet point truly summarizes what our Monday meetings were like. Outreach specialists guiding project managers and principal investigators on strategies and refinements. So for example, our hours increased when we communicated to our PIs and project managers that the amount of hours that we had to do this type of work was not enough. And our team was one where we were not afraid to talk about what worked and didn't work. So we had the advantage of having 4 different sites going at the same time where we were constantly learning from one another. And this led to the implementation of loteria, blood pressure checks, and so forth. And lastly, I truly believe that having principal investigators and project managers that were supportive empowered all of my colleagues and I to constantly seek more for our communities who deserve the same information and same opportunities as everyone else. So I'm going to go ahead and hand it back over to María Aranda for outcomes and lessons learned.
Thank you, Scarlett. Excellent. Okay. In the remaining part of this talk, I'll give information in terms of lessons learned and some of the outcomes. Well, first of all, this particular table addresses the number of participants that were referred to the AHEAD clinical trial to date. As you can see, we have over 162 individuals that were referred, the majority Latino Hispanic. Of those that were referred, the number of participants that actually are currently in the post-referral process, you can see that many less were referred. So for example, I should say either pre-screened or screened or enrolled. For example, the pre-screened, there were only 88 of the 160 some that were actually pre-screened by the AHEAD site staff. Of those, only 7 were actually screened, and as you can see there, the fat zero were enrolled, okay? So we can speculate what that means, and I have some ideas that we discussed with the team. First of all, if you take a lot of time from the referral process to when somebody calls them, you know what happens. So for us, I always use this as getting anybody referred is a miracle. Second, if we wait too much time in between, that interest may wane, or worse, people may think that maybe it wasn't an important thing to participate in. So we have to be careful about that. The other thing is this was during the pandemic, and we know that that does affect people's motivations and our processes as well. The other thing that could have been that there was limited language capability at these sites, and as a result, that could have been a factor. And lastly, now that we think back, we probably should have had a warm handoff. So clinical trial staff, recruitment personnel, and outreach specialists should work together to ensure a warm handoff and circling back with the final disposition of the referrals. In other words, engagement should be over the long run. And though we did not have the funds to do the navigation, that probably should have been done in between the referrals and the actual pre-screens, screens, and enrollment. Trial PIs and scientific team members need to examine what components of the trial design need retooling. Is it that the trial needs to look at their inclusion-exclusion criteria? Are there certain indicator cutoffs or thresholds? For example, amyloid, the level of amyloid depositions, is that maybe a characteristic or an indicator that we should be looking at? Language and cultural capabilities of the scientific teams at all levels, not just those on the front line. Also considerations regarding low literacy and numeracy. We did see that that was a consideration even in our initial processes. Also looking at the issues of trust, warmth, personalismo, and inclusion. We really should be looking at the attitude of imbuing I belong here versus the 1.5 scenario, meaning we should probably rethink how we say Latinos, Hispanics, Latinx are 1.5 times more likely to develop, dementia, Alzheimer's. Think about when you use it and how you use it, because if you use it repeatedly, people feel that maybe they don't belong there and there's something else that's going on. And we need to pay particular attention to the budget. Budgets need to be very robust for recruitment and retention, which was mentioned yesterday. You get what you pay for. Also, the timing of the outreach specialists and the hiring. This was important because, as you know, sometimes we don't get our project award for a few months, weeks, too long. And then when we get it, we're in that process of hiring people and getting them trained and on board. And that may also affect referrals. Also engaging personnel, research personnel, advisory groups, and the two organizations that we worked with in problem solving from the beginning. And we saw that in the Monday morning meetings when there was problem solving, when things weren't going right or things were going well. There was a lot of this discussion about how to make sure that those, the things that were going well were actually leveraged even more so. Also, the importance of fostering an esprit de corps is fundamental to the mission. And remember, I know we don't like to use the word marketing, but recruitment and retention, there are aspects of marketing that we have to really acknowledge here. And then looking at upstream structural factors have to be addressed nationally. And many of you may have already read this publication that we released earlier this year on the call to address structural barriers to Hispanic Latino representation in clinical trials. So instead of looking at the family and individual level barriers to participation, we really need to look at those upstream factors such as robust awards that look at really under financing these recruitment budgets. Also looking at study protocols and how they're developed and how they may actually go against Latino participation. Okay, so what are some of the innovations? We develop a scalable approach leveraging the infrastructure of trusted national and local organizations. Our outreach specialists supported the two organizations in 4 cities, guiding the team via Monday reflection meetings. The presentations, tablings, and other activities were led by the Latino, Hispanic nurses and Alzheimer's representatives. There was a bilingual presence, and it was important to have the National Association of Nurses because, as you know, second to physicians, nurses have a very high position in the healthcare hierarchy. And also the Alzheimer's Association, given their trusted years of advocacy in this space. Also making sure that the activities are culturally and linguistically tailored from the bottom up, not from the top down. Also making sure that your scientific team has lived experience and addressing not only micro level and meso level factors, but looking at also macro level factors. With that, thank you very much.